Good evening. I'm very impressed. It's starting time and we're ready to start. So I'd like to welcome you all here, and I hope you enjoy the evening. It's a great crowd, and first of all, I want to say thank you to the several individuals and organizations who helped us get the word out about tonight's event. Thank you very much. I want to tell you a little, just for a minute, what the organization is, who we are, who organized tonight. It's the National Association of Federal Retirees, the largest national advocacy organization representing active and retired members of the Federal Public Service, the Canadian Armed Forces, and the RCMP, as well as their partners and their survivors. Excuse me, I think I have one of those frogs in the throat. We're an advocacy association promoting the interests of our members and seniors in general. Just that to say we're not a union with bargaining power, so we're not going to be asking anyone to go on strike tonight. We have about 7,000 members in 6 branches in New Brunswick, about 175,000 across the country. This branch, Fredericton District, has around 1,900 members, and about half of them have had careers in the armed forces. There's more information about the organization, if anyone's interested, on the tables outside, and obviously we have members throughout the crowd who would love to talk to you. I want to mention the committee who organized this. Our committee chair and the leader of this whole event really grabbed it and went to work on it is Chris Goddard. Chris is in the back, and he's done a great job on this. Other committee members were John Richards, Ian Culligan, Denise Blanchard, Mike McCormick, and Dorma Grant. So I would like to welcome each of the candidates. I'll just name them from the far left. Gerald Bork with KISS. Chris Durant, the NDP.
Hi there.
Morris Shannon, People's Alliance.
Hello.
Susan Holt, the Liberal Party. David Kuhn with the Green Party. And Scott Smith with the Progressive Conservative. And finally, I want to say a word about our moderator, Mr. Leonard LeBlanc here. Grew up in New Brunswick, began his career in teaching, and then moved into the federal civil service. His career included being director of the corporate programs at the Atlantic Canada Opportunities Agency here in Fredericton, and regional vice chairman of the Atlantic region of the National Parole Board. After retirement, Leonard became involved with the association. He was first elected to our national board in 2011 and has been re-elected ever since. He chairs the Audit and Risk Management Committee, the Volunteer Recognition Committee, and he's a member of the Planning Committee, and he's been on just about every other committee. So I would like to turn the evening over to Mr. LeBlanc. Thank you, and please enjoy yourself.
Thank you, Elliot. And good evening, everyone. Bonsoir à vous tous. Vous aurez l'occasion de poser des questions dans la langue de votre choix, soit en français ou en anglais, parce que je vais demander s'il y a des questions à poser aux candidats venant de vous comme membres de l'Assemblée. As Elliot has said, thank you all to the candidates for your presence here this evening. We plan on ending the session at 8 p.m. sharp, and Chris at the back of the room will help us by being the timekeeper. The candidates were informed that we held a draw earlier to determine the seating order of the candidates. So this is randomly set in front of you. Each speaker is allowed 2 minutes for their response to questions. Please do not interrupt the candidates during their response to the questions. I will proceed by asking 3 questions prepared by the organizing committee and then I will invite questions from the audience. The candidates have been informed that a red card will be flashed to them, letting them know that they have 30 seconds remaining. And Chris, as our timekeeper, will be flashing the card in back, so you will not see the card here, but they will all see the card. Each candidate will have 2 minutes to make a brief closing statement at the end. So let's get started right away. The first question, it'll be to Mr. Smith, and then we'll go down the line to each one. The aging population has increased the demand for timely health care programs and services, particularly for seniors. The cost to address this situation continues to climb with no end in sight. Given New Brunswick's already dire fiscal situation and many competing priorities, how would your government go about seeing that sufficient revenues are generated and or costs reduced to be able to properly meet the needs of seniors in New Brunswick? Mr. Smith.
Thank you, Leonard. For anyone who doesn't know me, my name is Scott Smith. If I had opening remarks, I think I would address this right from the beginning because it is so important to us. Progressive Conservative Party has focused on creating a senior home care plan. This is where we consult with seniors about where they want to age. We then support them so that they can age in place where they want. And we're going to protect our assets, not try to seize them, but make sure that they can live at home for as long as they can and have the best quality of life that they possibly can. Not only is that good for people who want to age in place in their own homes, that's actually relieves.
Sorry, your mic's not on.
Well, it helps if it was on, wouldn't it?
That's right.
What's that? Do I get an extra minute?
Yeah, that's right.
Testing, testing, testing. Was everybody able to hear me anyway? Yeah. People at the back? All right, excellent. That's okay. So essentially we want to continue with that, and that is our focus, so that again, as I could reiterate, seniors can stay at home, have a quality of life in their own homes. This relieves the healthcare system for those who truly need it. The senior and care centers for those who have requirements for those services. But for people who just need help getting ready in the morning or at night and want to maintain their own homes and have a quality of life and independence that goes with it, that's what we want to support. Thank you.
Mr. Kuhn.
Merci, Monsieur Leblanc. Is this working? Yes, it is. Excellent. Good evening, everyone. I think to begin with, one, we have to acknowledge that seniors are not liabilities because so often the system treats seniors as liabilities. Oh no, this is going to increase our costs. That's not the way to start. It's true that, well, I'm a baby boomer as well, and you know, the demographics have been changing. We've been knowing this for a long time, and the senior end of the population is expanding. We shouldn't think of that as a bad thing. But yes, there will be additional costs. We have to acknowledge that and deal with it. I think we've been in kind of a position of denial. Said, oh, well, we're not going to spend any more money down the road, but there are going to be some additional costs. There's no question. But, you know, there are additional costs for other things over time that have come along. So how do we do this? Well, I think there's two approaches. One is we don't have to do the most expensive thing. That's probably a good idea. And I think there's lots of wisdom and good ideas within our communities to ensure that the kinds of services that are there and needed can be provided. I think of our nonprofit community-based nursing homes, for example, that benefit from the tremendous volunteer contributions and the efforts of their community-based board to ensure the kind of care and quality of life is there for the residents. So it's that kind of community base that's important, and I think the other thing is we really have to begin collaborating with the people on the ground who are involved in delivering the services, because when I meet them, they seem to have all kinds of great ideas that make sense, good sense, but there seems to be a disconnect often between what decisions are made within government to try and address particular challenges and the ideas that are coming from those on the front lines. So I'd like to see that kind of collaboration. there's some things we can't afford to do. And when you raise that twice, I guess that means I'm over time.
That's right.
So thank you very much. I'll respect the timekeeper there because he's doing a good job.
Merci beaucoup. Bonjour tout le monde. Mon nom c'est Susan Holt. Je suis la candidate libérale pour la circonscription de Fredericton Sud. So I think the question was two parts, if I understood it correctly. And one was, how is the government going to generate sufficient revenues to cover what's forecast to be additional costs, as David just describes? The costs will be greater because all of us are getting older, and we want to have more sophisticated, more reliable, and better services and options for our entire population and for our population that's aging. So the pieces that I want to highlight in this brief amount of time will try to cover both of those things. One of the things that this government has done was created the New Brunswick Council on Aging, and it was chaired by a very well-respected gentleman named Ken McGeorge, who I'm assuming many of you in the room know. That council put together an excellent report and delivered that strategy to government. It contains a number of different recommendations about what to do. Governments received that report and agreed to fund the necessary dollars to action the recommendations that the council made. So they had some principles that they were operating under with that strategy. They told us they wanted to make sure that we were applying respect, collaboration, equity, independence, choice, and a continuum of care. So those are the principles that we need to consider as we advance a variety of different care solutions. Everything from being able to stay in your home as long as you want, and this government has already put in place a program to cover the costs to do that, so people can have money back from the government to make their homes appropriately functional for them to stay as long as they can. On the flip side, there's a number of things this government has done to try and grow the economy and ensure that we have the revenues to cover these increased costs. And we've been pleased to see the GDP growth over the past 4 years, significant GDP growth, better than forecast in each of the 3 years that we have data for. So we will continue to invest pretty strategically in economic development. I'd love to talk about that when more time permits, so that we have the monies to ensure that we are delivering a whole continuum of care, from staying in your home to different models of collaborative living arrangements, all the way through to nursing homes and memory beds and those sorts of things, because we need the continuum to give the population choice, and we need a growing and robust economy to cover the cost.
Thank you, Mrs. Holt. Ms. Holt? Mr. Shannon, please.
Thank you, and thank you for having me here this evening on behalf of People's Alliance Party. This is something that we are hearing constantly at each and every door that we visit. Very much concern about our aging population, and very much fear among our seniors that are in our communities. For me, I come from a lot of rural area, being born and raised in Hoyt. So in that area, these people are kind of away from a lot of the essential services, being out in the country, the rural living. They have a great distance to travel to medical facilities as well. Many of these people have expressed to me that they're really scared of what their future is. I know for a number of years, and many, many years, we have been talking about our aging population and about the baby boom era and what was coming and what was coming. But it seems that we haven't planned any further than where we were 20 years ago. We still have a problem. I'm not convinced from some of the things that I'm hearing from patients and from people with loved ones in residences and stuff, that the program we are providing is adequate. I've talked to some of the people who have, for example, loved ones in the Shannix operation, which are in them homes. The price is high. I'm not convinced that the quality of care level and the respect for our elderly is there with some of the things I'm hearing. I think we need to look more to private care. I know there's people interested in private care, and we got to make something attractive to our young people, because these young people are not getting involved in this profession anymore. It's a high stressful situation with low pay. We need to do more for our seniors.
Thank you, Mr. Shannon. Mr. Durant, please.
Hi there, I'm Chris Durant. I'm the NDP candidate here in Fredericton South. And you look like an audience that appreciates specifics. So I'm going to try to be specific in what I'm saying and avoid generalities. So the NDP, we want to invest in home care. We're going to do that by expanding the extramural program, and we're going to create a new government agency called a home care service to oversee this. Part of the disturbing trend we've seen in the delivery of home care services under the Liberal government is that they took the management of the extramural program, gave it to a private company, Medavie. What is the first thing Medavie has done? Medavie cut the amount that the home care workers are paid for their mileage going to clients' homes. The effect of this is that people living in Boys Town, people living in Doketown, no longer can, some of them are having struggles to get home care workers to come to their homes. What is the effect of this? It means people end up in nursing homes sooner, people end up in the hospital sooner, and it ends up having more of a financial burden on our system. So that's what, and that ends up reducing the amount of services allowed for everyone. So by keeping our home care services public and making them accessible to everyone, that's ultimately going to reduce the amount of costs in our medical system. On top of that, an NDP government would be an energetic advocate for this province. We have a premier right now, Brian Gallant, who was the first premier to break from the other premiers in their negotiations with the federal government concerning the transfer subsidies for healthcare. And the result is New Brunswick isn't getting extra funding to help care for seniors, pay for end-of-life care. And we're the oldest province in the country. And you know what? I love it that people go and they work in Alberta or they work in Ontario and they have their careers there, but then they want to come back to New Brunswick. An NDP government would fight for a fair equalization formula that accounts for seniors.
Thank you, Mr. Durant. Mr. Burke, please.
Thank you very much. I'm Gerald Burke, and I'm the newest kid on the block, I guess. The reason most people don't know about me is the CBC has not put me on. A year and a half ago, I went to them and wanted to get on the Terry Saget program, but they said, no, there's too many now. And Mr. Urban's not pleased because I asked him to stop spraying the forest and stop this clear cutting causing these floods. I really appreciate this question. I really got concerns about it. But our biggest problem is the debt, and if we don't get this debt under control, there's not going to be money for these programs and that. And yes, I looked after my mother until she was 100 years and 50 days old, and she lived in her house, and it can be done. And we had help from our family, and we had some help from the government. And these are the type of programs that I think we have to extend on. But right now, we're paying $82,000 an hour interest going to the bankers just to service our debt. So the reason we started this KISS party is that we just got to get this debt under control, or a lot of these things are all not going to be able to work with them to get things done. And there's lots that can be done, and there's really some great things that the healthcare have done and whatnot. And I seen it with my mother's service and one thing and another and that, and that's about it. I just we got to get the debt under control first. Thank you.
Thank you, Mr. Rick. We're going to take 30 seconds here just to do an adjustment with the mics. Thank you very much. We're going to proceed with the second question. Now it'll be to Mr. Kuhn. We'll start off on the second question. So the second question goes as follows. In September 2017, the New Brunswick government awarded Medavie Health Services a 10-year contract to manage Ambulance New Brunswick, extramural and telecare 811 services. Knowing that New Brunswick has financial hardship, is outsourcing our health services fiscally responsible, and would your party continue this practice in the future? Mr. Kuhn.
Merci, Monsieur Lebrun. Thank you very much. Now I'm farther away from the microphone, so I hope it's picking up. No, we would not. In fact, we would cancel the contracts that were signed and bring back Medavie into our regional health authorities, so that once again we have a seamless system of health care between our hospitals and the extramural health services. Right now, with the new system, essentially a wall has been built between the hospital services and what was the hospital without walls, extramural, by putting it into a new Crown corporation, or a new corporation, I guess, government corporation, and giving its management to Medavie. So we need to be breaking down silos, not creating new ones, and it's actually costing us more to do that than it was before. So we would cancel the contract and bring extramural back into the regional health authorities. It's the jewel and the crown of our healthcare system. Everyone loves our extramural system. It has played such an important role in so many people's lives, and in fact in their deaths, with the kind of care they provided at home as people were dying. So we want to do that. And on the ambulance side, I would bring that into the public system. I think that pretty clear by now that after 10 years, the management of our ambulance system has proven to be poor with the mess it's in. It's kind of spun out of control in terms of ensuring that we've got good service, particularly in rural New Brunswick, and so I bring that back into public management as well. Really important. Right now, we have a situation where in the response time in rural New Brunswick is constantly, or quite often, poor, and we've had lots of examples of where people have had to use their own vehicles to get to the hospital in emergency situations. That shouldn't be the case. That's a management problem, and we need to fix that, and we need to fix it in the public system. So that's how we would do it, and actually we would, bringing Medavie back in, we would also add the similar to what the NDP is talking about, add the home workers into kind of a team arrangement, but not create a new agency.
Thank you, Mr. Kuhn. Would you hold the mic close to your, just so that people hear better? Ms. Holt, please.
Thank you very much. I can understand that the fear that people are experiencing when it comes to the new deal with Medavie. I've heard it from people at the door. I've heard it from employees who are concerned about what these changes mean for the service that they deliver, and to David's point, to our world-class extramural system. So it is something that we are watching very closely because we have high expectations of this program. We expect it to deliver better care for New Brunswickers for a couple reasons. When you bring together the extramural program with Ambulance New Brunswick and with telecare, you get a coordinated effort and a better continuum of care so that the patient at their home gets people from any of those three groups who know their file and who can connect with each other. So one of the things we've seen is a much more effective referral from paramedics to extramural and back than we've seen in a long time. And we've had a number of anecdotes come forward of people who've been in just that situation where an ambulance has arrived to deliver them care, has been able to connect with their extramural record of service, connect with the person who delivers them extramural service, learn about that person's case, and deliver them the health care they need at their home right then and there, and vice versa. We've had situations where extramural folks have gone in to a home and realized that there's an emergency situation in place, and they have the ability to refer to paramedics under one system so that we can get faster service to that home. So it's our hope and expectation that this new program will improve the care that we are delivering to people. But we're watching it very closely to make sure that's the case, because the goal is to reduce hospitalization, which is expected to save us costs. The goal is to improve the care people are receiving in their homes and in their communities, because we want to make sure that New Brunswickers can stay where they want to be as long as possible. So we have hope. We're seeing signs that it's doing better. The kind of connections we're seeing between telecare to ambulance to extramural are really encouraging, but we're watching it very closely to make sure it delivers to the standards we expect in terms of return time, in terms of extramural performance. And if it doesn't, then there are lots of changes that can be made as per the contract.
Thank you, Ms. Holt. Mr. Shannon, please.
Yes, from the People's Alliance side, we made our stance very clear quite some time ago with the Medavie deal. We're not happy with it. People in the province are not happy with it. And one of the things that I think is the biggest problem of the way things were approached was the fact that everything was done in such secret. The deal was signed over the Christmas holidays when many people were not paying attention. We made multiple attempts so far to get information released to the public about what this is actually costing taxpayers without any success, because ultimately the taxpayer is paying for this. We all know about the ambulance problem. We hear that day in and day out. I lived in Fredericton Junction for about 11 years, and many of you may recall back a few years ago an incident with a young boy, 14 years old, by the name of Cody Jones, who died that evening because he went into a seizure and there was no ambulance available to transport him. He was an hour and 15 minutes getting an ambulance. I could see his house from mine. I could see the ambulance bay from my house. Our ambulance was out covering off for another area, and there was no ambulance available in Fredericton Junction. A young boy lost his life that night. And another thing that really concerned me about the whole thing, at that time, back a few years ago, there was a volunteer ambulance service in Fredericton Junction. Many of the people in that area are now on the fire department, were trained paramedics under the volunteer service. But the paramedics that were in that fire department that night were not dispatched as well, which was right beside the ambulance bay. We have a very serious problem with ambulance service in this province, and we can ignore what we want, but we've got paramedics leaving this province because they cannot meet the language requirements in this province that the province demands today. That needs to be fixed.
Thank you, Mr. Shannon. Mr. Durant.
What I would say is one huge problem we have in this province, it's not the deficit, it's defeatism. There's this minority of people in this province that are down on New Brunswick, and sadly, our government is among them. Rather than try to break down silos inside government, like David rightly pointed out, our government says we're not capable of doing that. Let's farm it out to a private company. Let's farm it out to a private company that will have to extract a profit from the venture and will be taking money out of New Brunswickers' pockets because of that, but we really don't believe that we can do any better. So therefore, let's farm it out to a private company. What the NDP is putting forward a program about breaking down silos. This home care service that I was talking about, we would be expanding to the telecare program at the same time with the idea of doing that expansion in a way that would interconnect the two programs. But it's the end result. I'm not sure I completely buy Susan's rhetoric of we're watching this program extremely carefully. That just signals to me that the downside of the program is evident, that they know that a private company will always be looking to squeeze every last penny out of the system. Let's believe in our government, let's believe in our province, let's bring these jobs back into the public government system where they belong.
Thank you, Mr. Durant. Mr. Burke, please.
Thank you. This question is very dear to my heart because when I moved up to Stanley in the early 70s and become a farmer, there was an accident up there and we had to lift the tractor off a gentleman and put him in the back of a station wagon and get him to Fredericton. And at that point, a group of us got together and we went after an ambulance service. We got the ambulance service, not realizing what we received, because later we found out it was the very first ambulance service in the province of New Brunswick. And from there it grew to 100 volunteer ambulance services in the province. I worked on it for 25 years. I became an ambulance instructor and trained the 36 members. And in the 25 years, we never had an ambulance that wasn't covered with people. And as far as the language goes, it's crazy what they're talking about. We used to pick people up that were French, and we would just ask them if they wanted service in French, and we would call the hospital and they would receive information in, they'd have someone there to meet them in French, both nurse and doctor, and it always worked out real good. In the ambulance, when you're going to the hospital, the attendant's main jobs is your vital signs to keep them going until you get to the hospital. They're not there to explain all the procedures that the hospital are going to do or anything like that. I don't believe this service is working good at all, and I think we all know it. And yes, it can be improved. Thank you.
Thank you, Mr. Burke.
All right, thank you for that question. This is extremely important because Medivine extramural care is obviously a keystone to our home care health Hope Care plan for seniors. So we want to make sure that it is running the best way it possibly can. Now, we were against the whole Medivie deal from the very start because it was all conducted in secrecy. There was the opposite of transparency actually deployed in this negotiations. We only got details about it after the fact and after we demanded them. At the time, the Progressive Conservative Party, we opposed this. We opposed Brian Gallant and the whole deal because we had concerns about separating extramural care from the rest of it and creating a silo effect. We had concerns about farming it out to a private industry who is going to be motivated by profit rather than providing care. We had lots of concerns. We opposed it. Now, that said, if we have the honor of forming government here in this after this election, that doesn't mean we're automatically going to turf Medivie right out the door on day one. We in New Brunswick have had a problem with one-term governments, have we not? 4 years, then 4 years, and then 4 years, and that lack of consistency is hurting our province. We want to make sure that we're not doing that same thing when we come into power, that we just automatically throw out everything that was done by the government before. There could be some things good to it, and we got to make sure that we pick up on that. We'll give Medivie 6 months before we make that decision. So we'll give it a chance. In terms of ambulances, we need to make sure that we have the best paramedic services available in our province because this is a life and death issue. When we have these emergencies, we shouldn't be limited by nickel and dime issues, by petty politics, by language. The Progressive Conservative Party, we're sick of people have to leave New Brunswick because they can't speak French. We want them to come here and learn to speak French and work for us. Thank you very much.
Thank you, Mr. Smith. The third question will start. We'll start with Ms. Holt. Third question is: in recent years, there have been a number of occasions when employees have found their employer had severely underfunded their pension account. This has left the employees in a financial quagmire at a time in their lives when limited options were available to them. What steps does your party plan to take to protect private sector employee pensions, including amendments to current legislation? Ms. Holt.
Thank you very much. This is a conversation that my dad and I have been having for how many years now, Dad? As we debate pensions, his, and pensions not mine, and how, I guess, yeah, and how those things should go when you have a lack of funds to cover an entire population of people that are expecting to be supported by those funds. And there's no easy answer. So for me, I go back to the principles of fairness. So right now, I think we have a situation in place that's not fair, and we need to address it and fix it. So that's the first piece in speaking directly to pensions at the provincial level. But we have seen this happen across the private sector where companies haven't put in place enough money to cover their liabilities to their employees, and then we end up in courts and with lawsuits and with crumbs being given to employees who otherwise put their blood, sweat, and tears into that company. So we absolutely need to strengthen the legislation that ensures that those private sector employers are paying out what is due to their employees before they're paying out the other obligations that they might have at the closure of their business. And so there is legislation that we can write to do that, and it's the kind of thing that I'm quite interested in. Actually, I've already been advocating within my party, particularly around provincial pensions, but also as somebody who worked in the private sector for a lot of years, and including for large companies. It's something that I've had personal experience with. None of the large companies that I worked with offered pensions that were defined benefit. So I had retirement contributions or RSP contribution matches, but never have I worked for a company that's had a defined benefit. I have worked for employers who have those conditions when I was in the New Brunswick Business Council. So as CEO of the New Brunswick Business Council, my members there, some of whom had pension obligations to their employees. We need legislation that strengthens the payment back to those employees first before other obligations are delivered.
Thank you, Ms. Holt.
Yes,
Mr. Shannon.
as a federal public service employee, currently on leave, pensions is a big issue in our area for sure. There's a lot of things that I question around the pension system. A lot of things that probably a lot of other people question around the pension system, where we've had different issues where governments have taken from pension funds, only to discover years down the road that money is missing, never to be replaced. It's happened here in the province. One of the big things that come up before the last election under the PC government was the change in the New Brunswick pension plan. That was a big concern with a lot of people, and it's still a big concern with a lot of people. Is that going to happen again? Who knows? But one of the things that really concerned me about that, you sign a contract with the people. A contract is a contract. That's it. There's no going back and breaking it. If you go buy a car and you sign a contract to pay for your car, the bank doesn't come back to you 6 months later and say, oh, we're going to double your payments because we can. The government signed this contract with the people. They need to respect this contract with the people. Another thing that really upsets me, and this really got under my skin, when I seen the raise to the old age pension, 57 cents a month. Now let's get real, people. If you save that 57 cents a month for a whole 12 months, you can buy yourself a Happy Meal. Maybe. You can't take anybody with you, but you can buy a Happy Meal if it hasn't gone up. We need to do more for our pensioners, and we need to protect our pension plans for the aging people in this province. Thank you.
Thank you, Mr. Shannon. Mr. Durant.
Yes, certainly. I agree with Morris. The first thing we need to do about the private sector is get the public sector in order. The change made by David Allward's government, changing the provincial pension plan, was disgraceful. Pensions are deferred salary. That was a contract between the employees, and it was a breach of trust to make that change retroactively. Then we had a Liberal government that promised that they would undo the change, and they didn't. They kept it. So at first, keep the public sector in order. Secondly, one thing that I'm in favor of, and this is something that the federal NDP has been fighting for years, is to make retirees and employees, when it comes to pensions, to make them creditors of first priority. That if a company goes under, that before anyone else gets paid, it's the employees who get paid their salaries and their pensions, because that is the most important thing. Workers are the most vulnerable people. Their jobs are often their only source of income, and so that's what needs to be honored. Thank you very much.
Thank you, Mr. Durant. Mr. Burke, please.
This is one thing that I really can't comment too much on. I was a dairy farmer. There was no pension plans. I was a volunteer for ambulance service, for search and rescue, and for critical incident stress. There was no pension plans. So all I will say on it is that, yes, I think there may be an issue out there, and if I was involved in government, I would certainly look into seeing and learning about it, because I'm not knowledgeable on it, and that's a fact. Thank you.
Thank you, Mr. Burke. Mr. Smith.
All right, thank you. And thank you for that question, everyone. And again, I believe everyone remembers when Blaine Higgs did take those changes to the pension system. We all remember that. There's quite a lot of anger over that. There's people in this room who are really angry about it. I was concerned about it. But one thing that's worthy of note is that Blaine Higgs did that in front of you all. He came out and did that in public. He met with the crowds, angry as they were. And he talked to you, and he looked you in the eye, and he told you why this needed to be done. Now, maybe there wasn't as much communication of the dire need to do this. We didn't evoke all the scary stories from Detroit that could have been. But the fact is, it was done with transparency, because that was the proper thing a leader does when they're making a hard decision. Contrast to the deal that Brian Gallant made for Medivie, which was all done behind closed doors, with no one consulted, no audience faced, no one discussed. So yes, we did make a hard decision over the pension program. I can't take any credit for it myself, but it's sustainable and everyone will have it. Whereas before, they could have worried about losing it around this time if nothing was done. And certainly Brian Gallant had a chance to change it, and he didn't. In terms of private businesses, yes, we'd like to see them establish a plan as well. But one thing we've got to make sure we're not doing is putting more and more administrative burdens on our poor businesses that are struggling under all these changing regulations and additional requirements for this and that and the other thing. Our business people are spending hours doing administration. They need a lawyer and an accountant before they can get a marketer or a technician in their company. They can't expand their enterprises because they're wrapped up in this red tape. So as much as we want to see pension, we got to make sure that we in the government are assisting with that rather than just dictating requirements. And certainly, my leader is someone who can make those tough decisions. And I think if you don't like it, unfortunately, I hope you can respect it, because he did do it honestly and to your faces. Thank you.
Thank you, Mr. Smith. Mr. Kuhn, please.
Thank you very much. In our platform yesterday that we launched, we made two clear commitments. One was to launch an inquiry into the adequacy of pensions for all New Brunswickers, and as part of that, we could look at and would look at how best to protect those pensions. That was kind of what was supposed to happen under the Allward government. They were starting off to look at how to protect private pension funds because of what had happened in Aquic and so on, and then kind of pivoted to go after the public sector pension funds provincially. So the other thing we commit to in the platform is to make the pensions of provincial retirees whole again, to put them back the way they were for the retirees. Retirees were not part of the process, and the decision was made without you. So it was a contract. You were depending on that contract for your retirement, and so we would make that whole again. So those are the three things: inquiry into the adequacy of retirement funds, retirement for New Brunswickers across the boards, with some recommendations what could be done to help people there. 2, how to ensure that private sector pensions are safeguarded so that people don't come up on the short end. That's a question of justice. And 3, to make the pensions for public sector retirees provincially here whole again.
Thank you, Mr. Kuhn. Those are the 3 questions that were organized by the organizing committee. Now, I would invite you in the audience to ask questions to the candidates. Please indicate if your question is for a specific candidate. If it is not for a specific candidate, we will start with Mr. Shannon and go around to each of the candidates here. I will entertain questions in both languages. Vous pouvez poser des questions dans les 2 langues officielles. Mr. Ambo, who is in the back of the room with the mic, will provide you with a microphone to ask the questions. Please identify yourself when asking questions. And we'll start with any question from the audience.
Sorry, Leonard?
Identify yourself and then the question.
I'm still Cyril Terrio. I said that first. Advocates from all across this country have been calling for a comprehensive, focused national senior strategy to address infrastructure for care, caregiver support, home care, and age-friendly communities. Now, I know we've touched on a number of those areas tonight. Successful implementation of this strategy is going to require coordination and collaboration from provinces such as New Brunswick. And we could be on the leading edge because we're leading the aging. Does your party support a national senior strategy? And if so, will your party encourage the federal government to lead its implementation? And I would say a word of advice is if you don't support a national senior strategy, don't stay for coffee afterwards.
Mr. Shannon, you're first.
Yes, most certainly we would support a national senior strategy. Yeah, I totally agree with you. There seems to be so many decisions made in this province and in this country that exclude the actual people that it affects. That is one of the big things that really concerns me so much. I'll give you a little example of that. I know a doctor who lives in this area. For 3 years, this man has had the ground all zoned, the funding in place, everything is set to go. He can hire all of his staff. The only thing that he is asking for from the provincial government to build a 65-bed seniors care home in a rural area is a permit. 3 years he's been asking for this. He has not yet received the permit or a reply to it. These are areas, like especially, like I say, in our rural areas where people have grown up. They want to remain there as long as they can. Their families are there. Their families can visit. It makes their quality of life a lot better with their families there. But I think first thing that we have to do is we have to start talking. We have to start talking with our seniors. We have to involve more organizations representing seniors, and we have to listen instead of directing what we are going to do as a government for the best interest of seniors. We need to include seniors. We haven't included them in the decisions we've been making, and therefore they feel left out of it.
Thank you, Mr. Shannon. Mr. Durant, please.
Yes. Well, to touch on that, so by way of a little bit of introduction of myself, I work as a lawyer downtown on King Street, and so I spend a lot of time thinking about the Constitution. And one, which as I'm sure you all do too. And one of the beautiful things about our federal system is that we have different provinces, and the provinces have jurisdiction over social services, and each province acts as a provincial laboratory that each province can try different policies, and we see what's most effective and what isn't effective. But obviously we need a strategy where there's coordination, where there's information sharing between the provinces, and so federalism only works when you have the federal government playing a coordinating role. So I'm absolutely in favor of a national seniors strategy to help share best practices and help to identify what role the federal government should be playing in making sure that our seniors are getting the care they deserve because they've worked so hard and helped to build this country. So I'm absolutely in agreement with you. I think there's fabulous things happening around the country. I know various provinces are looking after their seniors. One thing, Ontario has introduced a seniors Bill of Rights, and this is an easily understood Bill of Rights for seniors that is required to be posted in seniors' homes so that seniors know what their rights are in their interactions with the home. This is something that Ontario has implemented. The New Brunswick NDP has said that's a fantastic idea, and that's something that we have in the platform that we are going to be running on this election. There's fabulous ideas out there, but yes, we need someone playing a role. It's coordinating our efforts for taking care of our seniors. Thank you so much for the question.
Thank you, Mr. Durant. Mr. Burke, please.
Yeah, I'd like a coffee after this too. We got to agree with the other two members, and I think there is a lot that if we get a group like youth people and other people, and every community is a little bit different. Right here in Fredericton, you have a great group. Out in the country, where I live out in Stanley, there's no great big organization and group like that really meets regularly and stuff like that. So, yeah, every little area has a little bit different, and we have to look at it all and really get in there and help. And like I say, I've worked in the ambulance service, and I've looked after my mother, and that's all part of it, and there's a whole lot that more can be done. Thank you.
Thank you, Mr. Burke. Mr. Smith, please.
Yes, and thank you for that. Obviously, yes, I'll do one better than the rest of everyone. Not only do we want to commit to it, we want to be leaders in that. And I think New Brunswick can be, and I think it's time that New Brunswick starts taking more of a leadership role in our country. We are the only bilingual province. That shouldn't be a disadvantage. That should be a competitive advantage. That should make us the leaders in this country. on this and many other issues. We need to stop thinking of seniors as a burden, as something that is a problem. We need to start looking at what we have, an enormous resource. Just looking around this room, I can imagine the experience that is held just right here. As somebody who likes to think of themselves as a lifelong learner, I could just imagine everything I can learn from the life experiences here. There is so much expertise in our in our senior age population, and we need to draw on that. That's why we want to consult with seniors first and foremost when we develop our strategies, as well as to work with people like Cecile Casista, who's a fierce champion for seniors and nursing home residents. And we want to work with people like that and consult with seniors so that we can not only advance a national senior policy, but we can help be leaders.
Thank you, Mr. Smith. Mr. Kuhn, please.
Thank you. Cyril, is there dessert on the line as well as the coffee? I kind of need to know. Before I tell you how terrible this idea is. No, I think it's a great idea, and this is why. It's needed, but I'm a big fan of federal provincial agreements from national strategies. Why is that? Because one, it brings us some money. That's good to help us do things that we can't otherwise do. But most importantly, it helps get some of the politics out of the design of these programs. Because the federal government will set sort of some overall parameters about what they would like to see based on what they heard in terms of goals and objectives to be met. And then the province comes to the table and negotiates sort of our part of that through a federal provincial agreement. So it kind of takes some of the politics out of it. The one improvement I think we can make is that when our provincial governments go and negotiate these federal provincial agreements, that they're transparent about it. In other words, we all know what they're trying to get from the federal government. We all know what they're putting on the table, what they're looking for, and in fact, they should be talking to all of you, or we should be talking to all of you about what the priorities are before we go to the table and have discussions with the feds about how we want this tailored for New Brunswick. So that would make a huge difference. I don't know how long it's going to take to get a national senior strategy, whether there's the political will out there or not. You could see how and maybe we could have, I know we could have done a better job, but the political difficulty in convincing the federal government that provinces like ours need a health transfer that's adjusted for our demographics is significant. We could have tackled that differently, I think, in collaboration with the other Atlantic provinces and probably Quebec to make a common front. So this part of the region has to work together. This part of Canada has to work together to convince Canada that this is something that we need here because other provinces aren't in the same situation as ours. Thanks.
Thank you, Mr. Kuhn. Ms. Holt, please.
Thank you very much, Cyril, for the question. I absolutely support a national senior strategy, and as someone who's been a civil servant for the last few years, learning how to work the civil service and the bureaucracy is something. I think everybody in this room probably knows quite a bit about working through the complexities of the federal government and the time that it's taken to get this far. I think New Brunswick has an opportunity to lead this for a couple reasons. We're already out front. So we have a minister responsible for seniors. The federal government just appointed somebody in July. So they're sort of getting there, but we were already there ahead of them. We have an aging strategy developed in collaboration with some great people, and I think it could provide a bit of a blueprint for other provinces. And specifically, we just negotiated a first of its kind pilot, the Healthy Aging Pilot, that is worth tens of millions of dollars between the federal government and the provincial government to try some things here that New Brunswick is well positioned to try because of our urban and rural population, our French and our English population, our aging population. It means that we can be the leaders, and this Healthy Aging Pilot that the feds have agreed to partner with New Brunswick on gets me really excited. So I think we have examples of where New Brunswick's been able to take the lead on a seniors issue with the federal government. We've already have a strategy in place and a minister responsible. I understand that federal retirees want to see a blueprint in place that covers an integrated continuum of care so that you're looking at home care being included, housing being included, community pieces being included. We've seen great progress on the age-friendly community initiative, and that's been picked up by New Maryland, by the city of Fredericton, and other places. So I have a lot of hope that with New Brunswick's active participation, we may be able to see the federal government move more quickly on a national senior strategy. And I would be proud to be part of the government, as we have over the last 4 years, take that leadership in our own province and bring it to the national level and to the feds.
Thank you, Ms. Holt. There's a question here.
My name's Randy Dickinson, and I'm a longtime disability advocate. First of all, I want to thank the audience for posing great questions for the candidates to comment on and related to service for seniors, different options to support them to remain in the community as long as possible. And definitely the pension issue is one that needs to be addressed, and I think it's going to require both federal and provincial legislative reform to protect pensions first. As the payer, they should be covered first before any other creditors are dealt with, and that covers both public and private pensions. But my question today, in piggybacking on the issue of looking at a range of options to address different needs for different types of seniors with different levels of support requirements. I was attending a meeting recently on services for adults with autism in New Brunswick. New Brunswick has become a leader on services for children with autism, but we have a number of aging parents who have adult sons and daughters who, once they finish the public school age, and they can go up to age 21 in that system, and then they're thrown back to the home, and there's no real system or strategy or action plan to deal with them. I'd like the candidates to comment as to whether they could commit to their parties investigating and consulting with parents, caregivers, stakeholders, including adults who live with autism themselves. But we have two types of clientele. We have very complex needs that require a lot of support needs. Right now, the only option is sending them to the Restigouche Hospital in Campbellton. You live in Fredericton or St. John or Moncton, you don't want to have to travel to Campbellton to be able to see your son or daughter, especially in a place that's not structured with the type of programming and trained staff to deal with autism. There's also a lot of adults with autism who are living independently, and they need different types of support in employment or housing or what have you in order to remain independent. And as a taxpayer, I'd rather create an action plan and strategy that supports adults with autism to remain in the community as independent as they can with the supports that they need, rather than warehouse them in a provincial mental health hospital where they don't belong. So I'd be interested to see a comment on that.
Thank you.
Thank you.
First one is Mr. Durant, please.
Thank you so much for the question. I think I really enjoy questions about people with disabilities. It's an issue close to my heart. For 6 years, I worked at camps for kids with disabilities, kids and teenagers in the summer, physical disabilities, intellectual disabilities. And when these people are in the right environment, they really do thrive. But they need to be in the right environment. Part of my work as a lawyer, we have a client right now. It's a family from Moncton, and they have 2 daughters, both with autism. And they have been struggling so hard to get services. The social development has actually been quite helpful, but it's services inside the school. The school board has really let them down. Their EA, their educational assistants that work with them, change every year. The moment the girls get used to someone or someone knows how to work with them and help them, they change. And it's ended with these girls being actually warehoused really inside their own school, not being in the classroom, just taken to a separate room every day, alone, sometimes left alone. And that's one reason why I became a lawyer. I'm happy to be advocating for these people and fighting and making sure the school board owns up to what they've done. So absolutely, I think we need to be consulting widely with these individuals, with their families, about how to get them the services that they need. And it's a matter of investment. When they get the services they need in early childhood, but then in later childhood as well, it makes them able to participate in our society so much more. We can't be playing games with our educational system because of that. I know the Liberal government, when it took power, it cut 249 positions from our educational system, and now they are advertising, we're going to add 250 teachers. What the Liberals giveth, the Liberals can taketh away.
Thank you, Mr. Durant. Mr. Burke, please.
Thank you. Yes, there's several people in our community that had problems with children that way, and I can see the stress and the strain that these families going through, and I really can't imagine wanting to have to go through that myself. And I think there should be programs for communities and areas that would have groups that would, help these people in that, and only be sent to the hospital if they got real serious and that type of thing. And they should all be working together to solve these types of problems. Thank you.
Thank you, Mr. Burke. Mr. Smith, please.
Yes, thank you, Randy, for that question. And of course, it was very enlightening to be at that event a couple weekends ago. This is actually very important to me, and so much so, last night I attended my leaders convention in Quispamsis, where he formally accepted the nomination. You can imagine it's a pretty busy time for the guy. There's a lot of things going on. When I got a chance to speak to him, I asked him, what is our plan for long-term autism care, and how do we continue that here in New Brunswick and make sure that we have the best that we can possibly provide. Again, I don't feel people who have any of these conditions or are on the spectrum are a disadvantage, a burden. I think these are, again, possible potential. With just a little bit of accommodation, we can get enormous advantages. These people can have a great quality of life. They're no different. They have some challenges, but they have so much to give. So we need to make sure that we have a comprehensive strategy, not one that sends them to Campbellton, to a facility that was just located for pure partisan reasons, but one that actually caters to their needs. For the people who are severely in requirement of services, so they could have the care that they require, so that their parents have the relief. We're talking about parents who are in a constant lifetime of worrying about their children's safety. These people live with such a level of heightened anxiety. They need help, and we got to make sure that we help them. We got to make sure that people who are functional are functioning at the best potential that they can, and that is not something we're giving. I guarantee this is something we will get back from these people because they have so much to give us in return. Thank you.
Thank you, Mr. Smith. Mr. Kuhn, please.
Thanks for the question, Randy. It would be a tremendous relief for so many parents to know that there was something in place to ensure that their adult children are cared for in a way that's appropriate in the community when they no longer are able to or can't. And that's, I think, one of the key things. This needs to be established within our communities. The system needs to be put into at a community level. It needs to be done appropriately with the right training for staff. And we've got a great foundation to build on here because of the preschool autism program in New Brunswick. We've got lots of expertise, a tremendously well-networked community of parents, tremendous people to get around the table and talk about how do we design this in a way that really meets the need of autistic adults now and into the future. This community-based, where the staff is well-trained and that appropriately meets their requirements. That's not complicated, it would seem to me, to figure this out. We've got lots of good people with good intent, with good knowledge and expertise and experience. It's a question of bringing them together, putting together a plan for what this would look like, and having government collaborate with them to implement it. So it shouldn't be difficult, but it seems to have been difficult to this point. I know the advocates have worked so hard for many years now to get government's attention to do something about this. It's getting urgent. We need to act now, and I believe we can put together, as we said in our platform, kind of drawing on the special care home model in the community with the appropriately trained people, an excellent home for autistic adults to reside in and get the care they require and have the quality of life that they deserve.
Thank you, Mr. Kuhn. Ms. Hull, please. Thank you.
Thank you. Thank you, Randy, for the question. Randy's pretty modest. He didn't point out that he was just named the chair of the Premier's Council on Disability. So congratulations on that appointment. I'm really pleased that you're going to be in that role, because it's going to that role, I think, is critical to what we're talking about today. So I was at the same meeting that Randy and Scott was at a few weeks ago, organized by the Autism Advocacy Advocates for New Brunswick. I've been spending a lot of time learning about this particular issue, from conversations with parents going back months ago to meetings with the NBACL, with the folks who are organizing a L'Arche home here in Fredericton, with my colleagues at the Civil Service, and with people like Haley Flero from Ability New Brunswick, because it maybe is a little more complicated than it seems. So I agree with the principles of the proposal that's being put in place, but I hear the fear that has been expressed to me by the people who are around this issue. So there is a lot of fear associated with moving in a way that is perceived to be back to the center care model. That scares people. It scares certain adults with autism who do not want to be institutionalized. And so when a proposal suggests a residential service for adults with autism, some people get really nervous about that and concerned about it. So it is a little more complicated than it seems at the surface. But we absolutely agree with the idea that we've talked about, actually, in terms of seniors, of a spectrum of options, because autism is a spectrum disorder. We have people who have very high functioning opportunities to live independently, and we have people who need virtually 24/7 care, and their parents are really not in a position to deliver that any longer, or are concerned about what happens after they pass away. So it is very complicated. We are extraordinarily fortunate here in New Brunswick to have leaders in autism, behavioral specialists, board certified, and a program for the young that goes up to 18 that is world class. So world class that we're selling it abroad. So we have places like UNB that have sold curriculum to France, and we have places like the government of New Brunswick that's now selling curriculum around the world. So we can do this. It's quite complicated. There are steps to take to fulfill the spectrum of services. It's something I've been really enjoying learning about, and I'm eager to continue working on.
Thank you, Ms. Ho. Now, Mr. Shannon, please.
Yes, thank you again for your time and putting yourself out there to volunteer and lobby for this kind of opportunity for our people of the province of Brunswick. It's people like you that help make this difference. And we really appreciate having people like you in the community. I heard a couple things mentioned here. One of them being the constant change in the education system. One of the things with children at young age is the comfort of having consistency. Consistency being able to deal with the people they recognize. I have a niece who is very, very active with young children like this. She just loves it. It's her, I believe it's her calling, because they relate so well to her. And one of the things that upsets young children so quickly in the younger age is when you take that consistency away from them. I think we need to work harder. I think we need to work harder with people like you, because many of these decisions are left in the bottom end of it in the hands of government. That is where we end up running into a problem. We need to have more people involved on the front line, decision making, and we've said this time and time again with our education system and our healthcare system. If we want to know the problems, ask the people who are on the front line. Bring them in, include them. They're the ones with the expertise, they're the ones with the knowledge. We have to start listening to them.
Thank you, Mr. Shannon. Okay, we have time for one more question. There'll be closing statements also at the end by each of the candidates, so we're going to go ahead with one more question. One.
Merci, Monsieur Leblanc. First of all, thank you all for being here, and thank you for participating in the political process. We're easy. This is simple. We're sitting here and we're listening to you. It's not easy being up front, and you know we may or may not agree with all of the positions that you take. Susan, thank you for being the sole woman on our panel. I'd love to see more of you. For those of you who know me, you know I had to make that comment. Mais ma question, my question, is very personal to me. I am a fairly newcomer to the Capital Region. I've only been here for 40 years. I moved here from a primarily Francophone area, but I've made the choice, this is my home, this is my community. I want to age in place. I am retired. I am now building the next chapter of my life and whatnot. But in aging, I know I will be developing certain disabilities, certain vulnerabilities, and part of those is using my second language, which happens to be English. Ma langue maternelle est le français. Je sais qu'en vieillissant, je vais perdre en grande partie ma capacité de comprendre l'anglais. So the services, and I'm talking primarily basic services, when a caregiver asks you, where does it hurt, that I'm able to answer, for that care provider to understand my question and for me to be able to understand, to be able to respond, is how do we ensure that the growing population of Francophones in the Capital Region, because I see several in this room actually, can receive from the Regional Health Authority the services in the language of their choice. And it's not even a choice at that point in time. It's really a basic right, because I need to be able to say, my left arm hurts or my right arm hurts, and not get the wrong treatment because I can't be understood. So I believe in a national strategy, but we also need some very practical local solutions for the actual people who live here.
Was your question directed to all the candidates, or is your question directed to a specific candidate, or is your question, is it a comment? Okay, Mr. Burt then.
I think that, here in the Fredericton area, we should have some people that can speak both languages that are dealing with these people, and they should get to know their clients that are French and be able to send the person out so they can communicate very generally, or very comfortably with their thing. I don't think we can possibly manage the cost of having everybody bilingual to work it. So I think when we have French people in that, we should be able to get a person or two working in that field that will look after those people more specifically, and that should help solve the problem.
Mr. Smith, please. Mr. Smith.
Oui, merci pour votre question, madame. C'est un sujet très important. Certainly, we want to make sure, one of the big, I think, parts to this is that we need to make sure that people providing this home care are being paid a fair wage. I mean, this is an employment equity question, really, that's the way I see it. Because right now, we're not paying people enough to provide what is extremely valuable service. Right now, people have a decision, do I want to work as a special care worker, or do I want to pour coffee in Tim Hortons? I mean, that's not right. So if we have proper employment equity resolved on this issue, we would have support workers who are getting paid, we would have retention so that we'd have support workers with experience and expertise, and certainly with the language requirements to serve their clientele. And should there be a French nursing home, if there's requirements for that, certainly, certainement. Thank you. Merci
Thank you,
beaucoup.
Mr. Kuhn, please.
Thank you. So the key thing here is, if we are going to meet the needs of our community, and in our community here, I'm convinced there's a clear need for a nursing home for Francophones in our community. Obviously, look at our school system. People grow up, graduate, go to work, and then some, in the end of towards the latter part of their life, need long-term care, nursing home care. So it makes obviously complete sense. But we need a system where community members, organizations can come forward with a proposal to develop nonprofit, community-based nursing homes that a government, whoever it is, will respond to, and get away from this corporatization of our nursing home system, where they're putting out requests for proposals that are secret, which I tried to go to court to get and was turned down, and only those big corporate nursing home companies can compete for. So if we want to serve the community, We need to have a system that will receive and acknowledge and support community-based proposals to meet our community's needs for nursing home care.
Thank you. Mr. Kuhn, Ms. Ho, please.
Merci beaucoup pour la question, Norma. Puis merci beaucoup aussi pour votre leadership. Norma est une de les femmes qui est... Norma's a leader in the Women for 50% movement. It's the work that she did that mean people like me are at this table is because they encouraged folks like me to step up when I otherwise might not have thought that I could. So merci beaucoup pour ça. Puis je comprends complètement pourquoi vous avez de la peur que quand vous êtes plus âgé, puis peut-être vous pouvez seulement communiquer en français, vous ne voulez pas que l'ambulance arrive, puis il ne vous comprend pas quand tu essayes de leur dire c'est quoi qui est mal. I can't imagine how scary that would be, communicating with a healthcare or emergency professional, trying to tell them what's wrong in your language and having them not understand you. So I think it is critical that we make sure that every person in this province has access to healthcare in the language that they communicate. I don't think it's as simple as expecting them to just hold on until we get to the hospital and there'll be a French nurse or doctor waiting there. I don't think that's good enough. If it was my parent or my friend who was in that situation, I would want to make sure that that ambulance or paramedic service delivery person could serve them. So we need to do things to fix that system, but I don't want to see Norma get substandard care because the person who's taking care of her health doesn't understand her. So our government is very committed to ensuring that we continue to improve upon and ensure that everyone gets served in the language that is their choice, their native language, the language that they choose for those critical services. So I think in specifically, there was a question about the nursing home proposal. I had a fantastic conversation with a gentleman at a door about this. Robert was passionate about this project. He described to me the proposal. He told me about all the steps that he had taken to bring it to fruition and bring it to government's doorsteps. I completely agree. As David said, there is a need in this community. We have a very vibrant francophone population. So je suis excitée de trouver la façon qu'on peut avancer ce programme pour un service à la maison or a community nursing home en français.
Thank you, Ms. Holt. Mr. Shannon, please.
Yes, I totally agree. It's about equality. Equality for all New Brunswick, for everybody. We have many, many cultures in this province, not just Francophone and Anglophone cultures. We have many, many cultures in this province, and we're getting more and more continually. We need to be able to have an education, excuse me, an education system where we are preparing people for this. Some of the issues that we have right now, and I question of whether sometimes how well this is working. We have played around so much with the French immersion system at early childhood, going up through our education system as well, and we're getting not so great results. We totally agree with everybody receiving equitable treatment in this province. And like I say, as more and more cultures grow in this province, and more people, especially in the Fredericton area, because we have a large number of different cultures in this province. Totally agree. Equality for us all. That's what we have always been about in New Brunswick. That's what we've always been able to do. And most certainly, I fully agree with and understand what is being said in regards to this.
Thank you, Mr. Shen. Mr. Durant, please.
Merci beaucoup, Norma, pour votre question. C'est vrai que je ne suis pas une femme, mais je suis tellement fier d'être un membre de la partie, le seul parti avec une femme pour un chef, et aussi une partie que pendant l'élection, on a 50% femmes pour notre candidate. So je suis tellement fier de ça. As for your question about service in your own language, I completely understand. I originally come from Lennoxville, Quebec. I come from the small Anglophone minority that lives there. My parents still live there and are aging, and it's an issue that touches my heart because I know when my parents need hospital care, they will need it in English, and they fight so hard to make sure that those services are available, because if you give an inch, that's the first step to it all being wiped away. So you know what, I stand for anyone who's asking for bilingual paramedics in Minto. I understand why they're doing that. You know, and you know what? And part of excuse me, I know I'm very loud, but I will use the microphone just for anyone who might need it. And you know what? And part of these things is Scott made a good point about funding these people, paying the workers properly. I'll be very interested to see what the minimum wage proposal in the Conservative platform is. But you know, and it's all about funding our services. The NDP, we want to raise the corporate tax rate from 13% to 15%. That's where it is in PEI. That's where it is in Nova Scotia. No one has ever said, gee whiz, business is going so, you know, the economy is going so well in New Brunswick because of that 2% difference in the corporate tax cut. We just need to stand up to our corporate overlords and tax them properly so that we can provide the service that people deserve.
Thank you, Mr. Durant. The timekeeper has told me very clearly that time is up, so we're going to hear the final concluding statements by each one, and then we'll have the final remarks by both myself and by Elliot. So, Mr. Smith.
Oh. Well, thank you very much for having us here today, and thank you everyone for coming in. This is an extremely great opportunity to be able, for us as candidates, to look at you and talk to you and meet you all and discuss all these ideas. Really, some things there was a lot we didn't get to talk about, though. One thing we didn't get to talk about, for instance, that's going to be real important to everybody's life and how we finance things here in New Brunswick is the carbon tax. We never got to talk about that. That's going to be 11.6 cents on the liter. That's going to increase everything you pay for. Not just your gas, but your groceries, your energy, every commodity you pay for. It's going to cost the average family up to $1,200. How many here, just wondering, just curious, how many here can afford an extra $1,200 to pay for Brian Gallant's carbon tax? Okay, and you want to? Just to be clear. So this is an issue that I think is a grave concern to people on fixed income, people on low income, and for just ordinary folks across this province. We need to really take a look this election. Some outstanding candidates up here. Let me tell you, I'm extremely proud to be up here with such respectable people that I have such a huge admiration for. But really, it's going to be hard for the voter, I understand, but you need to make a decision. Can you afford 4 more years of Brian Gallant? Can you afford the carbon tax he will bring with it? If you can't, then I'm afraid I may be the only choice you have to replace Brian Gallant. Thank you very much.
Thank you, Mr. Smith. Mr. Kuhn.
Well, there's always 4 years of David Kuhn. The Greens' vision for New Brunswick is a province that's community-driven, that's just, it's fair, equal, and sustainable. And there shouldn't be any daylight between citizens of this province and our government. And there is such a gulf now between government and the citizens of this province that it is leading to all kinds of divisiveness and problems that we shouldn't have to deal with. We should be thinking of our government as our government, not the government that does things to us that we don't like. So we need a change in the culture, really, of government, which is people are elected to serve, people are elected to govern, people are elected to govern in the public interest, to serve the common good, not just of us here alive today, but for our children and their children to come in the future, to be able to take the long-term view, not to be captured by special interests, not to be captured by partisan political interests where too many decisions get made that's all about the next election, but to truly serve and serve for the common good. And when we do that, then that gap starts to shrink between government and all of us. There should be no we and they. It should just be we. And that's my passion, that we get to that point where once again we will be together to work to address the big challenges we're facing in this province and create the kind of future for our kids and their kids that we really want to see. Thanks.
Thank you, Mr. Kuhn. Ms. Holt, please.
Thank you very much. Because I don't know many of you in the room, I would like to take a little bit of time just to tell you a bit about myself and how I came to be here. So I was raised in Fredericton South, and I appreciate my dad's in the room here. Both my mom and dad and my in-laws live in Fredericton today. I was really fortunate to grow up here. I went to Connaught Street School. I got a French immersion education from grade 1 on. I went to George Street and FHS. I scooped ice cream at Tingley's. I rang in your groceries possibly at Save Easy and performed with Characters Incorporated and had a really fortunate upbringing here in this city. I went away to Queen's University and got degrees in chemistry and economics, and then I traveled first to Toronto to learn how to sell, and then around the world to Australia and India and back to Canada to work in Ottawa for the private sector in HR roles, recruiting for large IT companies. And then my high school sweetheart suggested that I should come home, and he was right. So I moved back to Fredericton at the end of 2007, and John and I are since married and have 3 little girls, a 6-year-old Molly, a 4-year-old Paige, and our 10-month-old Brooke. I love this place. It's home, and Fredericton South is the place I want to continue to raise my kids and the place that I'd like to represent. I have knocked on more than 4,000 doors since starting this. I have had 2,762 conversations with you, and I have been listening and listening and listening and asking questions and trying to understand and bringing my experience in the private sector, leading the Chamber of Commerce here in Fredericton, leading the New Brunswick Business Council, and for the last 3 years, learning about government as a civil servant. I think that combination of private sector, nonprofit leadership, and government understanding make me someone that can help you take your ideas where they belong, which is at the decision-making table in government. So the people of Fredericton South, I have learned, are full of huge ideas, progressive ideas. You're knowledgeable, you're experienced. That voice is missing at the cabinet table right now. And I think I can be the person to bring your ideas to the place where the decisions are made and the budgets are set. So I would love to have your support come September 24th. Merci beaucoup.
Thank you. Thank you, Ms. Holt. Mr. Shannon, please.
I'm not from the Fredericton riding, so I can't speak for the Fredericton riding itself. I am from the New Maryland Sunbury riding. Born and raised in Hoyt. I am 56 years old. I have never left the riding from the day I was born. I moved around a little bit in the riding, but I've never left the riding. I currently live in the Brunswick area, where I've been for the last 7 years. I have 2 children. I guess they're not children anymore. One's 28, one is 23. But I have 2 little grandchildren. One's 3, one's 3 months. So they're just starting out. I want to ensure that my children remain in this province. I want to ensure that my grandchildren remain in this province. My entire family is in this province. I want to make sure I stay in this province. But as things are going right now, it's getting tougher and tougher and tougher for our young people to remain in this province and proceed with the future. I've said on many different occasions that over the last 3 consecutive governments, or 4, that the only thing the governments have expanded in the province of New Brunswick is the long-term parking at the Fredericton Airport, which houses our people who are leaving to go out west. It's a shame. There's so many from my community. I just had a conversation with a lady the other day. She just come back from visiting all of her children in Alberta, all of her grandchildren. That shouldn't be. I don't believe for 1 minute that we have a financial money problem in this province, but we have a very serious spending problem. And until we get this debt under control, people, this province is going to continue to sink further down. And the first thing we need to do is end the corporate handouts and start investing in New Brunswick.
Thank you. Mr. Durant, please.
Hi there. David Kuhn has been the incumbent in this riding for 4 years, And I think it's uncontestable that he's put his heart and soul into it and deserves our respect. But part of respecting people is taking their ideas seriously. I've read the Green Party platform, and I think it deserves to be discussed about. And I think there's some things that, in terms of policy ideas, are questionable. David is proposing that we create an import substitution policy in this province. Now, that's something that sounds good. Oh, local businesses, selling to each other. But this is something that's been tried. It was tried for decades in South America, and it requires a lot of capital to invest in industries. It ultimately ends up meaning that the government subsidizes uncompetitive businesses in trying to prop them up and trying to make their products competitive with local, with imports. It's not successful because it goes against the economic idea of comparative advantage, is that everyone should be selling what they're best at making, and then when we all trade together, there's more to go around. It strikes me as a bad idea, and this province desperately needs change. The Liberals and the Conservatives, they have gone back and forth for decades, trying the same thing. And you know what? I think we are getting to the point where we have a shot at making a real change in this province. But that's why we need to have a real discussion about what kind of change we're going to make. New Brunswick can't spend its time and its money on ideas that sound good but really have no basis in reality. That's why the NDP, we want to take care of workers, we want to ensure that people are paid fairly, and we want to leave business alone with minimal interference to do its thing and to develop businesses that sell to New Brunswickers or to Canadians or across the world.
Thank you, Mr. Durant. Mr. Burke, please.
Thank you very much. I wish I had some real good news for you, but I'm afraid what the news is that this province is at the bottom of all the provinces in Canada. And the facts are, the Liberals and Conservatives put us there. And now they're standing here saying, oh, now we get all kinds of ideas and we're going to bring it all back up. I don't believe it for a minute. And I just can't see, it just was said that, we get lots of money, it's just a spending problem. Well, a $14 billion debt is not having lots of money as far as I can see. And so I was a dairy farmer, and I grew my farm up to 365 head of cattle, got allergic to cows, and well, it wasn't funny. Just like taking a heart attack and you couldn't go near the cows. But anyway, I owed $800,000. I built my farm up, and I built a new barn and all the modern equipment with it and one thing and another. And when I sat down and realized it, I went to my lawyer, and he said, well, declare bankrupt. And I said, no, I didn't make no deal that I want to, just drop it off on someone else and walk away. So I went to my creditors, and I sat down and explained it all. And I said, now, if you're going to work with me and we'll work this out, that's fine. And if you're not, then I'm done milking tonight, and you can milk the cows. And anyway, they agreed, and so we was able to work it out over, it took us several years, and that's exactly what's got to be done to New Brunswick right now, is to have someone, and to me, what I hear here, nobody's really thinks we got a serious debt problem. And a lot of these programs that you want, they're just not going to happen if they put us into receivership. Sorry, that's the news. Bye.
Thank you, Mr. Burke. Now, ladies and gentlemen, mesdames et messieurs, it was a privilege to gather with you and to learn more about the candidates' opinions on the issues that matter to our members and to seniors throughout New Brunswick. We thank you for the welcoming audience and coming out in such great numbers. We hope that today's meeting has been informative and will help you make your decision at the polls. Thank you, merci, and now Elliot has the final word.
Well, I'm really sorry we didn't have time for more questions. I did see some other hands in the air that I know had good questions behind them, but we said we'd finish at this time, and that is what we will do. I think we ought to, though, remember, it's great to live in a country where we can come out in public, like this, and express our opinions so freely. Well, we are truly lucky. And on top of that, I mean, just the icing on the cake, the candidates respect each other. And that, I mean, this is great. You probably have noticed the video recording. Things are being recorded for posterity tonight. If you don't want to wait too long, this recording will be on our website. If anyone or your friends would like to see part of it or all of it, federalretirees.ca, and go to the branches tab. You'll find our branch, and the recording will be there. So thank you very much to the candidates for coming out tonight. We appreciate it. It's been very informative. Thanks again, Chris, to you and your committee. What a great job. Good work. And to Leonard LeBlanc for being our moderator, taking that role on tonight. Thank you. And I also want to tell you that Leonard will be the moderator for a province-wide telephone town hall with the party leaders on September the 11th. Go to federalretirees.ca tomorrow for information about that. You can sign up, and you'll be called on your phone when that starts. You can listen by phone and call in questions. So, there are refreshments in the foyer. I hope the candidates can stay, and I hope that all of you will stop for a few minutes, have some refreshments, and ask them some more questions. Thank you.